So my name's Deborah James. I am Professor of Educational Psychology at Manchester Met University. And the Living Lab was my idea when I was designing the programme for our new area of undergraduate psychology in education. And for me, it was a place where I wanted to place the discipline of psychology into connection with policy and practice. So the Living Lab is essentially for students, for our partners who practice in the northwest of England and who make policies for the people of the northwest of England. And the Living Lab is our space where we connect. And today is the first time that we've had a connecting conversation. And I've invited Aji Lewis, who's here with us today, to talk about and share her story and her family's story. And also my colleague, Joy Duxbury, who's Professor of Mental Health at Manchester Met and who leads a big research group on mental health at the university. And Joy and Aji have been working together for a good many years. Why I invited these two inspirational women to open our lab for us is that sometimes I feel that our practices in public sector services fall short of our moral purpose. So any of us that are in public sector, we know that sometimes our practices and our policies are misaligned with each other and they don't really tie up with the moral purpose that we all hold when we enter public service. So the Living Lab is a place where I really want to draw together policy, practice and purpose and inspire our students and our partners in practice and inspire us as academics that these misalignments can be made well, and we can hope that through really working together in partnership, we can join up the gaps that so often open up between policy and practice. So I really think that's our storied worlds, our way of talking to each other about our experiences. When we share our work through stories, we're making our work accessible to everybody. But we're also flattening out the hierarchies that can open up between universities, people in practices and people who use services. So it's my choice in the Living Lab to make these connections through storying our lives and through really encouraging and helping us all to listen closely to the stories of other people, and that really ignites understanding of our own selves and our own existence. So Aji is going to do what she does, which is to speak from her heart and tell us about the story that she and her family have gone through since the passing of their precious Seni. And I know that you're going to find listening to Aji inspiring and encouraging. And my real deep aim is that by listening to her, the moral purpose of our duties in public sector are really enlivened and made more urgent, and also that we go out from this meeting with a clearer sense of purpose. And hope that we can make a change through the partnerships that we develop. After Aji's spoken, Joy is going to respond in a way to and with Aji's story, and she's going to tell us about all the ways in which she and the Restraint Reduction Network and others have worked with Aji and her family to ensure that Seni's passing results in fruit, especially in health and social care services and in services for people with mental health needs. So Joy is going to make that connection really real by telling you the story of the work that she and her colleagues have been doing to ensure that Seni's passing doesn't get forgotten and is put put into a place of real productivity in our services. So it's a real pleasure and joy to be able to welcome Aji and Joy. And Aji, I'm going to pass over to you now. If everybody else could please turn off their camera and their microphone, and we will enjoy listening to Aji for about 30 minutes, 30 to 40 minutes. Okay, Aji, I'm going to take this slide down now.
Okay. Thank you so much, Deborah. Deborah, I just want to say this is quite inspirational. It's a brilliant idea, and thank you, because our stories matter. Lived experience, and people who tell what has happened to them or their families or their loved ones, it matters. And it does, it's very, very informative. It hits home. People really connect with this sort of, you know, I think it's much better than a slide. And I'm going to ramble. I'm going to talk about our what happened to us, and basically why we do what we do, and as a family, and I do what I do, talk to groups, talk to anybody who will listen. Basically, everyone and anybody. I talk to them because I don't want what happened to us and what happened to Seni to happen to another living human being, another family. And that's my motivation. I always like to start with a little bit about Seni. He's a bit of a character. You know, he was an adventurer. You know, we had a tarantula, and the tarantula got out of its glass, whatever, enclosure. And all the children ran out of the house and left me to find it. I was petrified. I'm not a spider lover, you know, in spite of going every day to get a live locust or dead mouse from the pet shop and feed it, you know, that was my job. But, you know, anyway, you know, he got this tarantula, and it disappeared, you know, and I phoned my brother-in-law and I said, please, can you help me? He said, did I ask you to buy a tarantula? No, I'm not coming. So I thought, oh gosh, you know, they'd all gone. The children had gone, left me alone. My friend was phoning me to say, oh, the children are here. They say the tarantula's got out. I said, yes, would you like to come and help me? She said, oh, I don't think so. Anyway, I got a shoebox. I looked, I thought, oh, they like dark places. So I moved the curtain a bit, and there it was, massive thing. Tarantulas are big. Anyway, I got it in the shoebox, put it back in the glass, whatever, enclosure. And I said, you take that tomorrow, go and give it to your friend who also likes them. And he has a travel shop, go and give it to him. You know, I'm not having it in the house anymore. So this is what we, you know, Seni was, yeah, he was very popular. Lots of people, I know probably some of his friends are on. He was a much loved, you know, friend and son and brother and uncle. And we called him our gentle giant, our shining star. Yeah, you know, I just must tell you one more story. We used to go to Florida quite a bit to my uncle, and they learnt to jet ski. Seni and his older sister Lara learnt to jet ski. And the first time they said, don't go far, keep close, you know, this is your first time. But no, we saw Seni going miles out. And I was saying to my uncle, where is he going? They've said keep close to the shore. And then we noticed he stopped and there was a problem. And Lara quite bravely said, Mum, I'll go out and see what has happened. And she went out, and then they came back. I don't know, I think the jet ski had toppled over. And they tell you, if you lose a key, you're done for. You're stuck there. But luckily, they tied the key to the jet ski. Anyway, they came back, and my uncle said, go and sit down, Aji, go and have a drink, because he knew I was hopping mad, and I'll deal with this. And then he sent Seni over to apologize. And I said, where were you going? What were you doing? He said, Mum, how far is Cuba? I said, Cuba. What do you want to find Cuba for? He said, well, it's quite near on the map, you know, and I said, yes, but people are trying to get out of Cuba, not get in. I mean, this is in the era, you know, sort of early, maybe 1997, 2000, you know, that sort of time. Anyway, he was like that. Anyway, let me get on. Seni had was 23. This is in 2010. He'd just finished his master's and was going to go to America to do his PhD. And he went out. I don't know who with, because by the time I wanted to ask him questions, it was too late. He went out, but he came back with his best friend Omari, and he said, I said, why is Omari? Oh, you know, he wasn't feeling well, so he'd gone to Omari, and Omari had brought him back. And no, don't worry, Mum, I'll be all right. Because as soon as he said, you know, they'd given me something bad, or I've taken something bad, my heart was pounding. And I was looking after babysitting my youngest grandson, who was a few months old. Anyway, over that August bank holiday weekend, he'd got progressively more agitated. He couldn't settle, couldn't sleep. You know, everybody knew something was wrong. He knew something was wrong. And in the end, he decided that, look, he would go to A&E. And it's really, there is so much, because as you can imagine, it took us a long time to get our inquest, 7 years to get our inquest, so that a lot happened. But I remember on that day, and I've really never mentioned it before, he sat down, when he decided to go, he sat down on the chair and he said, Mum, I'm ready. I'm ready for what's going to happen. It's as if he knew something wasn't going to go right. He knew something wasn't going to, I don't know, maybe he knew he was going to die. I don't know. Because a few weeks before, all the things that we'd argued about, he'd come and apologized and said, you were right, Mum. I didn't want to tell you this, but, you know, and it's now I'm thinking, you know, isn't it wonderful how God has put thoughts in my mind that I've never, ever shared with anybody before. I don't think I've even shared them with the family. Anyway, he said, I'm ready. Let's go. As if, yeah, he knew something was going to happen. We went to A&E in our local hospital and he didn't settle, and they had to call the police. But the police were very good and brought him back and said, look, he needs help. He knows he needs help. We suggest, because we don't want anything to stain his record or anything, we suggest that, you know, you take him, or we take him with you to the Maudsley 136 suite. And I had no idea what that was. I had no idea. This was all new to us as a family. So I was looking after my mum, who lived with me and was not well. She had slight Alzheimer's, and I thought, okay, I'll go home, get her up, and his father and his best friend took him to the Maudsley. And then I thought, oh, I'll have a little nap. So I lay down. About 10:30, there was a call from them to say that, come, Shani's walked out. And I thought, oh my goodness. So I rushed over there. And by then they had got Shani back. What had happened, and this is what we found out during the inquest, Shani had not wanted to stay. He wasn't, you know, he walked out of the 136 suite and went to Herne Hill Station. Now, this is a busy station in London, and he sat on a bench, and people were worried. The police and the staff at the Maudsley were worried that in case maybe he would jump on the line or commit suicide or whatever, they weren't sure what he would do. So they were not sure whether to close down the line, close down the station. But anyway, this is where we see good police practice. The police came. They took off their jackets. They approached Shani. They got down. He was on the bench. He was sitting on the bench. They got down eye level. They talked to him. They joked. They laughed. They de-escalated the situation and then walked him back home. And not walked him back home, walked him back to the Maudsley, which was just nearby. And I thought, yeah, this is good practice. So in the end, when I got there, I found things very relaxed. Everybody was laughing. The police still had their jackets off. They were on the floor because in the 136 suite, there is nothing to sit on. Basically, it's foam mattress, foam chairs, you know, in case people harm themselves. Anyway, I stayed, Omari stayed, Shani's dad had to go home to look after his father. And then the community nurse came, community doctor came and said, look, either Shani could go home with me, but how could I cope? I couldn't cope because he was restless. He wanted to go out in the middle of the night. I couldn't go with him, and I knew he couldn't go alone. So I said, is there another option? And they said, yes, as a voluntary patient, he can stay. We would transfer him to the Bethlehem, where residents from your borough go to. And this is a mental health facility. And as a voluntary patient, he can leave at any time. They call you, you come and pick him, and he can leave. So that was in my mind, it was in Shani's mind. We made the journey to the Bethlehem in a taxi. And when we got there, I thought, this is very noisy. It wasn't very conducive. If you're not feeling well, I felt myself personally, I wouldn't like to come to a place like this. It was very noisy, very chaotic, doors slamming. Anyway, we didn't really have an option. So we left Shani there at about 8:30 after visiting. They took my number. Yes, he's a voluntary patient. When he wants to leave, we'll call you. There was staff changeover. And as I left, I phoned my eldest daughter. I said, Kemi, I want to stay in the car park for a bit. I'm not happy. My spirit is not happy. Something is not right. And she said, Mom, they've got your number. They've got, they'll call you if anything. They know he's a voluntary patient. They'll call you. So I went home to bed. About 10:30 that night, his best friend, Omari, called me and said, Mom, have they called you from the hospital? There's been an incident. No, they haven't called me. He said, well, you call them. So I called them. Yes, there'd been an incident. We have to, Mrs. Lewis, go to A&E at Mayday University Hospital. So his father, Omari, and I, we met other friends of his there. They were all perturbed. And we were told, we went into the family room. There were 3 police officers there. They got up. They were looking very sheepish. Oh, you're lucky that Sergeant so-and-so was there. He's very good at CPR. Pardon? What's happened? Oh, the doctor will be with you. The doctor came. He said, look, Shani is in a coma. He's on, we've transferred him to intensive care, and you can go and see him. We went up there. There was a police officer by his bed, and I thought, why is there a police officer by his bed? Anyway, the police officer went and we stayed. Now, I just want to say that we are a Christian family, a praying family, and we know my daughter at that time knew a lot of pastors in Croydon. So she called them, they said, we're coming to pray, stay with Shani, you go home, we'll pray, and then in the day you come. So that's what they did. And this went on for 2 to 3, maybe 3-4 days. You have to excuse me because I can't remember all the facts, so minutely. But anyway, we went home. Now, while we were home, I opened the door one day and I saw a young gentleman in a suit with a notepad with my neighbour. And my neighbour said, oh, Aji, here's a journalist. He wants to talk to you. So he came, he said, Mrs. Lewis, do you know what happened to your son? I said, we have no idea. He said, well, a whistleblower has called the Evening Standard. This is a London newspaper, and we are going to run a story. Do you want to make a comment? I said, what am I commenting about? I know nothing. You run the story, and then maybe tomorrow, you know, because they said they were running it for 2 days, I'll come and maybe comment. So they ran the story, and that's how we knew what had happened. Basically, a few hours, I mean, Seni, this was an hour or so after we left. Seni wasn't settled. He wanted to come home. They said no. I don't think they'd even done the doctor hadn't come to examine him. They were doing changeover. They hadn't read his file. They didn't know he was a voluntary patient. No, you can't go home. The doctor hasn't come. I think he got upset. They say he banged the door, and we learnt in the inquest that the person who called the police was not even a staff member. He was an agency nurse. Didn't even tell his manager or his you know, whoever's above him that he called the police. Just called the police and said there'd be criminal damage. Well, the next day when Seni's friends went to collect his stuff, they asked to see the criminal damage, and we didn't actually see anything. So anyway, I don't know, but they said there'd been criminal damage. They called the police, and basically 5 police officers came at first. No, they weren't going to restrain, everything was okay. Then the nursing staff asked them to restrain Seni while they gave him an injection. And I don't know in what sort of time scale. Anyway, eventually there were 11 police officers there, men and women, and they restrained Seni, gave him the injection, and were to take him downstairs to the seclusion room. He went downstairs, and when he came to the door of the seclusion room, he put his hands on the door frame because he didn't want to go in, because he knew he'd been in one earlier. He didn't want to be locked in one. And the police pushed him onto his stomach into the room, and he landed, I don't know, on the floor or the mattress. I mean, you can go to the inquest, the coroner's inquest notes. It's all online if anybody wants to do any research, you know. And anyway, they restrained Seni. They said at the inquest that they wanted to do a cell extraction. They wanted to leave him in the room and they exit. But of course, Seni was quite quick. He was very fit. So as they tried to leave the room, he got up and got to the door before they did, most of them. So they then handcuffed him, and 2 sets of handcuffs, one with his hand under his chin and his arm at the back, 2 sets of leg braces, basically pushed him back in. He fell on the ground. He was struggling because he didn't want to be restrained, because can you imagine how uncomfortable it is when you're handcuffed? The more you struggle, the tighter the handcuffs get. So I understand. Anyway, he struggled and they were determined to restrain him. Well, this restraint went on in 2 sets of restraints for up to 45 minutes. 11 police officers. They did it in groups, you know, 5 or 4, and then the other. Then they said, oh, in the inquest, we were so hot. We had to take off our jackets. Oh, we had to ask for water. And the coroner said, and what about the person you are restraining? Did you think about them? But obviously not. Obviously not. The adrenaline was flowing. They were hyped up. They were determined that they would restrain him. You know, we heard the narrative. Oh, he's the strongest person we've ever restrained. Excuse me, was he Superman? There were 5 of you at one stage and another 5 standing by. Was he Superman? Why didn't you let him just stand and sit? Why didn't you just watch, stand back? But no, they restrained him. And when his body went limp, after a total of 45 minutes, they said he was faking it. He was pretending. And they left the room instead of giving him CPR. And we learnt at the inquest, if they'd given him CPR, he would have survived. Anyway, they left the room. All the time, the nurse, staff and doctor were watching from behind a window, either unwilling or unable to interfere. When the police left the room, the door slammed, they had to find the key, found the key, saw he wasn't moving, then started CPR. So when we saw Seni in intensive care, we didn't know he'd been restrained for 45 minutes. We were hoping that he would come out of this coma. You know, that's what we were praying for. But after a few days, they did a brain stem cell test and found that there was no activity in the brains. So they said they were going to turn off the life support, and they said that on the Friday, but we agreed that they would do it on the Saturday, so his friends and family, my sister was working, could come. And so about 30 people gathered or more and prayed and sang, and then they turned off the life support. That was a Saturday. On the Sunday, a lot of people said they'd like to go with us to church and honour Seni. So we went to church on the Sunday. And this is a church we hadn't long started going to, maybe about 4 months, 5 months. And the pastor of the church had been coming to the hospital to pray and to keep an eye on us and to, you know, comfort us. And he said to us, when they turned the life support machine off, and when you come to church, I want to introduce you. And that's all he said. So on that Sunday after church, he introduced us to the younger sister of Sean Rigg. Sean Rigg was another black man who had been restrained and killed in Brixton police station. And it just so happened, one of the God moments that I often share, that his sister was in our church. I didn't know her. I didn't know the circumstances. Oh, I am sorry. My battery is running low in the computer. Oh dear, I am sorry. Oh dear. Sorry about that. Sorry. Anyway, so Sam was able to phone up Inquest, the charity that supports families, got us a lawyer, talked to the director, Deborah Cole, and I always joke with her, she was trying on dresses and, you know, in the boutique, and she said, yes, we'll get a lawyer for Aji and family on Monday morning. And then Sam said to me, phone up the coroner, make sure they don't do an autopsy, because that's what they like to do when the family are not represented. So I phoned up the coroner on duty and I said, look, we want to be present at the autopsy. Oh, we're doing it this afternoon, Sunday afternoon. I said, you better not, because I'm a lawyer and I will sue you. So don't do it. So they didn't do it. They left it till the Thursday when we were able to pay for our own, oh, I can't remember the name of the, anyway, whoever does the autopsy, I can't remember the name. Anyway, we paid for our own gentleman to go there, and with the state and the police, they did the autopsy. Then he came and reported to us at our lawyer's office, and the journey began. 7 years to get an inquest, 7 long years. And I must just say that eventually we got an inquest in 2017, 3 months, 29 days of evidence. And the jury, brilliant jury, found that Seni had died as a result of excessive, disproportionate and unreasonable restraint and force. And then that is when our MP, Steve Reed, who had supported us, said, look, I want a lasting legacy for Seni. I want him to have some sort of memorial. And he said, I'm going to introduce a bill in Parliament. And that's how we were able to get what I call Seni's Law, which is mental health units use of force law 2018, and Joy is going to speak about that. My biggest hope and prayer is that Seni's Law ensures that no other person dies like Seni did, or other family goes through what we do. But there is so much that Seni's Law, we're praying, is going to achieve. But more about that from Joy. Anyway, I just would like to say, I'm not sure how long I have, but I want to talk a little bit about encouraging. It sounds very negative, but I like to encourage everybody. I think it was Mark Twain who was supposed to have said, but we're not sure if he did. He said, nobody likes change, only a baby in a wet diaper, wet nappy. And it's so true. Nobody likes change, but change has to come. I always say, you know, little steps. Everybody works towards change in a positive way. Every person can do something that will bring change. You know, I mean, Steve Reed was able to bring change through Seni's Law. You know, we were able to talk. I'm able to talk to groups everywhere and anywhere, nationally, internationally. It's so much easier with Zoom, you know, but I do talk to groups everywhere. I try to encourage staff, police, that please, you're dealing with human beings. There are people. You know, put yourself in their position. They're like your family. Could be your mother, brother, son. It could be anybody. It could be you, because a lot of mental health staff have mental health issues as well. So it could be anybody. So put yourself in their position. Treat people like you would like to be treated. De-escalate. Step back. Think, why am I restraining this person? Is it because you want them to have an injection? Why? Or is it because they're not taking their medication? Or is it because they haven't done what you want them to do? So you're using it as a punishment? You know, think, step back, calm down, because they say that people who are being restrained have what they call ABD, excited delirium, which is not a medical term. It is not a disease. It's nothing. It's just been made up in America. But my point is, the police or whoever's restraining, they get hyped up. The adrenaline flows. Oh, we've got to restrain this person. They also get hyped up. They want to do what they want to do. You know, so let's all step back a bit. Let's think. Let's put ourselves in the position of the person you're dealing with. If you build up relationships with people, then restraint might be a thing of the past. Why are you prone restraining people? Which is what they did with Seni. If people don't know, prone restraint is when you're face down. Why are you doing that? Why are you handcuffing people? Leg braces. Why are you doing that? What is, where I came from originally in Nigeria, you would say, oh, corrupt, oh, heathen, barbaric. No, it's happening here. Things are happening here, and we've got to be aware. We've got to be aware. I just, you know, would like to also mention that it's not just Black families that are involved. There are many white families as well that are involved, Asian families, men, women, children that are restrained. So it's a bit of everybody. Everybody is restrained. And I really, really want people to think, step back, put themselves in the position of other people. Be a human being. You know, I just wanted to also pay tribute to other families who we are all friends. We have an organization, you can Google it, called UFFC, United Family and Friends of Those Who Died in State Custody. We have a march every the last Saturday of every October from Trafalgar Square to Downing Street. We try and cause a little trouble, but we don't really, because there are not enough of us. So if you feel led, please come and join us. Last October of every year, except last year because of COVID. I'd also like to thank Joy, the RRN, organisations like Mind, CPI, Inquest. These organisations have supported us. So many individuals have backed us, really encouraged us. My good friend, Dr. Colin King, phones me up most days, makes me laugh, you know, encourages me, encourages so many people, Deborah, Joy, so many people I can't mention, family and friends are encouraging us. I always like to end a little bit with some quotes because I think they're encouraged. And I know there's a lady called Gail Sheehy who said, if we don't change, we don't grow. If we don't grow, we aren't really living. We have to change. James Baldwin says, not everything that is faced can be changed, but nothing can be changed until it's faced. And it's so true. Change the way you look at things, and things you look at will change. Let's all be part of the movement. Let's all make progress. You know, George Bernard Shaw, progress is impossible without change, and those who cannot change their minds cannot change anything. Let's keep our minds open. Let us really, really keep our minds open. I just want to thank you all for listening. If you have any questions, please feel free to ask me. As you can imagine, a 10-year journey is very long, and there are so many things that I haven't been able to touch on, but I just wanted you to know why I'm passionate about sharing Shani's story. When I began, the Lord told me, forgive. That was difficult. It took me years and years and years, but he dragged me kicking and shouting. And I found that once I did that, I was able to talk. The doors were opened. Contacts came. I didn't have to do anything. I know faith is not for everybody, but that's what's got us through. Thank you very much.
Thank you so much. You've brought us face to face with the reality of what must be, I can imagine, the hardest thing you've ever had to face yourself. And I know in sharing that story that comes at a cost to you. So thank you for openly sharing your story and your understanding of what Shani means to you, his life and his passing, and what you're hoping for as a result of sharing your story with us today. What I'd like to do is to ask for people to just maybe put their cameras on, or unmute their mics and their cameras and give you a show of their appreciation so that you can see and feel how everybody's responded to your story. Could you just do that for me? Thank you.
Thank you.
Thank you, Aji. So what we're going to do now is hear the ways in which some people have already responded and been responding with Aji and her family over these last 10 years. And it's my great pleasure to welcome Joy Duxbury, Professor of Mental Health. And Joy, you're going to speak and share your story in response to Aji's story, and fill us in on the ways that you've been working with Aji and her family to bring change through this tragic, catastrophic event. So I'm going to hand over to you, Joy, now. Okay.
Thank you, Deborah. Thank you, Aji. Gosh, how I always end up following Aji, and I never quite know how to follow Aji. It's a very difficult thing to do, and what a dreadful experience Aji has been through. And the sad thing is that, as Aji's alluded to, not just Aji has had this dreadful experience. You know, there are a number of families in very similar situations, not just in the UK but internationally. You know, certainly the first instance I came across as a younger nurse way back when was the name of a chap called Rocky Bennett, David Bennett, in 1998, who died as a result of having been restrained. And he was the first case, I think, that hit the headlines, for want of a better word, Aji, and started raising this as an area of concern, not just in relation to restraint, but in relation to race disproportionality as well. And there's certainly been a plethora of activity since then. One of the things that struck me while Aji was speaking, I've heard Aji speak many times, and every time I hear something slightly different. And one thing I was thinking as I was listening, Aji, which made me feel dreadfully sad in a way, is that just to let you know, guys, I'm a mental health nurse by background. You know, worked as a mental health nurse for many years in inpatient services, in forensic services, in acute services. And as a young staff nurse way back when, I remember thinking, this isn't right. What we're doing in our services feels very much like we're just containing people all the time. We're not using ourselves as therapeutic tools. We're just trying to keep on top of a very perverse system, really. And I'm talking probably 30 odd years ago now. And I began to sort of agitate quite early on about trying to make change then. And I basically went off and did my PhD whilst I was still working in services. And that was the start of a journey for me, I think, Aji, of looking at how can we start making changes to practice. But the thing I was going to mention that made me feel a little sad is that, obviously, as a professor who's been doing work in trying to minimise the use of restricted practices for 20 years now, we did a piece of work for the Ministry of Justice a few years ago now, and we were asked to look, I've not had this conversation with you, Aji, actually. We were asked to look at the restraint-related deaths in the UK, and we did that piece of work. And when we did that piece of work, and it's just struck me now, Aji, one of the cases on that list was Seni. And you know, again, as researchers, it just makes me realise the humanity aspect of it. To me and the research team at the time, he was just another case that we were looking at. We were looking at the characteristics, we were looking at, you know, what happened, various things, but we weren't touched in the same way. And yeah, it's a very sad situation to think that he was just another number and just another statistic for us back then. And just as an aside, and that I think we did that report was around about 2012. So as I say, Seni was just in there then. And I think we reported 38 restraint-related deaths then that had happened in the previous 10 years. But they were only the cases that had been badged as being restraint-related, and that's a very muddy, messy area. We believe there are many, many more in the system. That's just an aside that I wanted to say. But how do you get from the story, and it's not just the story, is it? The living nightmare and hell that Aji and people have been through. How do you get from that point to making change in practice and policy? And it's an incredibly hard thing to do. But I think in this instance, we are beginning to start to make some significant change, Aji. There's a long way to go, and Aji will say this repeatedly. So there's three things I just want to mention, I guess, on that trajectory, how we've started making some of those changes. And I use the word we in a very broad sense as a collective, because this is a lot of people working together tirelessly over several years of agitating to make change and really trying to work together to make a difference, because we can't do this on our own. Aji can't do this on her own. I can't do this on my own. Politicians can't do this on their own. Practitioners can't do it on their own. They need help, they need support, they need evidence. And what we've done is, and I will mention Seni's Law in a sec, but the Restraint Reduction Network that Aji has referred to, I think that's an important network. And again, you know, having been a practitioner and having done a lot of research in the area, I came to the attention of various people over the years through the work that we've done. And I was fortunate enough to sort of be brought into things like Department of Health work over the years. The National Institute of Clinical Excellence have done work in this area. And, you know, so I've sat on a number of bodies, I think, where I've been able to influence change or starting to get the message out there. So we had the NICE guidelines in 2015 that drew on some of these matters and issues. And the Department of Health produced a document called Positive and Proactive that was really championed by a politician called Norman Lamb. And Norman, again, like Steve Reed, another politician that Aji has mentioned, has just been crucial to this work, because you do need these politicians on your side who are going to help bring your work, your stories, your journeys to the attention of the public and to the politicians in order to make change. And the Restraint Reduction Network, we've done a lot of work. So the Restraint Reduction Network was developed in 2014. I can't lay claim to developing the network myself. It was actually a chap called Chris Sterling, who works for the Crisis Prevention Institute, which is an international organisation, who asked a few of us to have like a roundtable event to start talking about all these issues and the guidance that existed, but this increasing plethora of horror stories that we were hearing over time, and how we could enact change collectively across the UK. So we set up, we had a few meetings amongst ourselves. We decided on key people that we might want to bring to the table, a mixture of, you know, politicians, practitioners, people from a range of multidisciplinary backgrounds, experts by experience, family members, and we started that journey in 2014. And then it was the British Institute of Learning Disabilities that came on board with us and sort of took over the RRN, because we were a little small fry for a couple of years, actually. We were having some, you know, okay, we were having some meetings, we were championing things, we were talking, but we weren't making great progress. And it's only really when Build came on board and with the weight of Build, I think, that we were able to start making bigger changes. I now chair the steering group for the Restraint Reduction Network, which is now a charity. So we became a charitable organisation about 3-4 years ago. I'm a trustee, Aji's a trustee, but I chair the Restraint Reduction steering group that we have 2-3 times a year. And that is a very, very powerful steering group. And it just shows you how when the willing come together, how you can enact change. There are so many key people on that group, aren't there, Aji, from across the piece. It's quite overwhelming, actually, of how we've brought those people with us and kept them with us. And as a result of the Restraint Reduction Network, not only were we able to support Aji in enacting Seni's Law. So Seni's Law got royal assent in 2018, as Aji said, and became law, became an act. Now we are still in the throes of getting statutory guidance to support that act, to make it happen in practice. So I guess the other thing that when you're trying to work together to make change is you have to be in this for the long haul. And you have to believe in what you're doing, Aji, don't you? And you have to believe that working together tirelessly, that you're going to meet challenges along the way. You're going to meet obstacles, and my goodness, if we had some obstacles along the way, but that you can make policy, you can change practice. And, you know, as I say, I certainly can't take any credit for Seni's Law at all. It was purely Aji and Steve Reed championing this. But I think certainly the RRN working with Aji has been able to make things move forward, and particularly with regards to the statutory guidance. Now, just to give you a little idea, and I know I don't have long, just a little bit about Shoney's law and what's going to happen when it does get fully enacted, is that basically, and sadly, it's only really for mental health units at the moment in England. And we want to change that. We want to obviously get it spread out much further than that. But basically, what it will mean is that units have I'm sorry, I'm reading this because of a raft of things that are really important to get across. Is that first and foremost that there has to be a dedicated person in every unit, every mental health unit, who is responsible for minimising restrictive practices. And they have to collect data and they have to report that data on a national database, but also to the Secretary of State on a yearly basis for their figures. So it's all about transparency and data collection. And the other thing that they have to do is that they have to make sure that they have the right training in place for staff with regards to minimise restrictive practices, but also in relation to things like trauma-informed care. So there will be a national syllabus. And that's where something called the Restraint Reduction Network training standards comes into play as well. So that's the other thing that we've been able to achieve through the standards that we've produced through the RRN, is that they were rolled out about 18 months ago now. And they have been supported by NHS England and driven by NHS England with us. They've gone out to all the trusts, and basically anybody in a health or social care setting in the UK who delivers training standards related to restraint and restrictive practices or aggression and violence, as some people have referred to these things in the past, have to be accredited against these standards. So whatever they are delivering, they have to follow a set curriculum that has to be formally accredited for them to be able to deliver that training. And a key aspect of that is working with experts by experience and family members in the delivery of that curriculum. There's a whole host of other things that I can't possibly tell you about now. And I would urge you, again, if you're interested in this area, to look at the Restraint Reduction Network website. We are a community of practice. We have a conference every year. There's so much work we're doing with Aji and other families as part of this agenda. And the other thing to say is that we're really keen, and that's how I buddied up with Deborah over the years, we're really keen to start recognising that this isn't just an issue in mental health services, it's much broader than that. And we know there are real concerns in our educational settings at the moment about significant issues to do with seclusion, segregation and restraint. And also learning disabilities services as well. But it's a massive area. But it is a journey we've all been on. As I say, I probably started my journey way before Aji ever was forced into a position of having to get involved in this area that I guess she would never have dreamt that she would have. But I think research, policy and practice can come together, with the right people around the table. And the right people who are willing to work together, to listen to each other, and to be there for the long haul, basically. And I guess that gives you a sense, Deborah, hopefully, of where we're at. There's lots more detail, I could go into, but we don't have time for that today.
Thank you, Joy. Thank you especially for not just sharing in an accessible way the work that you've been leading on with the Restraint Reduction Network, but actually most of all for sharing the honest response to Aji's story that you had when you listened to it again. And I know you've worked with Aji for a long time, but to raise to our consciousness the fact that when we're doing research and looking in papers and at documents, and reading about where cases have gone, where people's lives have come to a catastrophe, and we read that as a case, and you've got a fresh sense of that today. But thank you so much for sharing, because for me that's what the Living Lab is about. Aji talked about a new realization, a new memory that came to her about this very intimate moment between yourself, Aji, and Seni before he died. And this is the hope that in really listening and in being open to listen, that new realizations can come to us that will shape us all going forward. So Joy, thank you so much for being open and honest and showing that critical awareness of your own practice as a researcher and as a practitioner, because it's that kind of openness that you've modelled in the talk today that is our hope for change. So thank you so much. I would like to ask the colleagues again to just put your cameras on and unmute yourselves and just show your appreciation for Joy. Thank you. Aji, before we go to the chat and before we invite colleagues to ask some questions or make some comments, I'd just love to come back to you, because I've got a feeling that as Joy was speaking, maybe there were one or two things that you just like to pick up on or highlight for us. Any other thoughts, Aji, that you'd like to share with us?
Yes, I would like to ask people to put themselves in the family's position. You know, we get people, it's a buzzword, lived experience. Do you know how hard that can be to share? And a lot of families break up, are broken when they lose a loved one. A lot of families, I'm quite blessed in a way, because we've had our problems, but it also means that our faith has sort of kept us going as a family. But I just would like people to know the effects of trauma. You know, and as Joy was talking about racism, you know, it's, people say, you know, just going back, George Floyd was awful because we saw it happen live. There were no cameras, unfortunately, in the seclusion room where Seni was killed, because the room was being renovated, so they hadn't put the cameras back. But can you, to see that, all right, no wonder it mobilized the world. It mobilized the world. People were disgusted, you know. But can I just say, as a family here living in England, I want people to know that don't look at abroad, don't look at other countries so much, look at what's happening here. Look at what's happening here. And Joy talked about spreading Seni's law. A very good friend of mine, I can see her now, Vanessa Bob, I can see her. Yeah, I can see you, Vanessa. Yeah, brilliant, brilliant. Is an advocate for autism. She has children who are autistic. I've known Vanessa. In fact, Vanessa was the one who did the video of Seni's funeral. That's how long I've known her. Yeah. Yeah. So, you know, this is a big, big problem that we are facing. And it is a problem. It's something that we really have to try and get round. We do the best we can. And I just want to big up Rachel Whitaker, who is the lead for the guidance for Seni's law. She's the lead at the Department of Health. Thank you, Rachel, because she has no lived experience. I don't think. She's never mentioned it. She may have. But she hasn't, as far as I know, she has no lived experience in mental health. But she listens, she goes around, she came to inquest, she came to, you know, she goes around, she listens, she always attends the RRN, committee meetings and this sort of thing. Because if we don't bring in a robust, and I mean robust, guidance, then what's the point? Really, there's no point. Because people will continue to die. That's it. That is a bare facts. Rachel, it's got to be robust. I know I'm talking to you because I can see you, something you put in the chat. I can't see you on screen, but please let us be as robust as we can, because it's human nature. People in institutions find ways round things. Oh, that wasn't restraint. You know, yes, it was. You didn't actually lay your hands on somebody, but you restrained them maybe by, you know, physics and by, by your intonation, by saying, okay, you can't go out because you didn't do this. You know, I really, I'm just bigging up people because people do care. And that is a good thing. People care. And I say little steps. We can't do it all at once, but we can do, everybody do a little. Sorry, that's me, but I'd love to take some questions. I can see Colin King.
Thank you, Aji. So that's just been great, but more rousing for us. And also, when you responded there, I can really see the role of research in bringing that rigour into the context. I know Joy's been doing that, and that more rigour, thinking about the guidance, but also to ensure that the guidance is really well implemented. And I just want to pick up on Norman Lamb's name, who's come up a couple of times in your life, Aji, but also Norman Lamb has been a real advocate for early intervention in the early years. Norman Lamb has got behind that particular agenda. And so for us in education, the role of early years and working with schools and young people is really geared up towards preventing and reducing trauma and supporting families and children, so that the restraints don't become necessary later on in the life course. So a big shout out to Norman Lamb, and it's really lovely to be able to praise politicians for their work in society. So thank you, Aji, for that. Vanessa, I can see that you've got your camera on, and I'm just wondering if you would love to speak back. I know that we've met a few times on the Restraint Reduction Network, and I'm thinking it would be lovely to hear from you, Vanessa, and then I'll open it up to other colleagues who might want to make a comment or ask a question. Vanessa, would you be happy to start us off and let us know a bit about you, and then take over? Hello.
Okay. How I got to meet Aji is my son Nathaniel, who's 18 now. He was in the same class as her grandson, Manny.
Yes.
And Nathaniel at the time came from a mainstream school. His behaviour was very challenging. I was told that this school will help him, and my life was traumatic because I worked in TV, but nobody was listening to me. And all I remembered, Aji said, I don't think this school is for your son. He needs to leave. But the school keep on saying there was nothing wrong. Prior to that, he got diagnosed with autism, ADHD. Nobody would listen to me. Between Kemi, Seni's sister, and Aji, they're the ones that pushed me. I got him out, and then from there, I was very lonely, very isolated, but this family helped me. And then when Seni passed, I was asked, would you come and do the funeral? And it was very traumatic for me because I sort of wanted to give up, but I did it. And I still have to give them the actual final edited version up to all these years. They've still never had it. And I have got it, so I'm going to give it to them. But it was traumatic for me in a way because I just remember she was just there for me. And I wanted to make sure that I was there for her, because my journey has been where I'm still fighting a fight, because now my daughter, who's 15, was diagnosed 10 years later. And my older one, she's 20 and got a 4-year-old child. Again, autism in the community, in the Black community, in the communities is very difficult as it is already, because when you look at behaviour is one thing, but for my children, young people, autistic and Black, it's another journey that I wouldn't want to bring on to anybody. It is hard, but I'm here. And he is hard work, but I'm glad with the help of the Lewis family, I don't think my son would be where he is now. I think he would have been in a mental institute because the way he was being challenged in the years. But he's a remarkable young man now. And my daughter's saying no, he's not. But thank you, everybody. Thank you, Aji.
Thank you, Vanessa. Thanks for sharing your story and your family with us as well. It's lovely to see you again. Thank you.
No problem.
You know, Vanessa, do get in touch with us, because we are going to be developing a little community of practice around the schools work and around children who have particular and special things that they bring to us. So please do keep staying in touch with us. That's lovely. Thanks, Vanessa. Thank you. Now, I don't think so far there are any actual questions in the chat. I've been keeping my eye on it. We have got about 20 minutes or so for anybody that would like to maybe tell Aji or Joy about what today has like triggered in their minds, or ask Aji or Joy a question. You're really welcome to either pop your hand up and I'll keep an eye on the participant list, or just put your camera on and then I'll be able to see you.
Could I just ask Colin King, when this lady, Dr. Colin King, I'm sure he has a lot, he's inspired me, so yeah.
Thanks, Aji. I think Faith, you had
Yes,
your hand
Faith.
up earlier
Yes,
on,
Faith.
so can we come to you, Faith? Thank you. Just tell us who you are, Faith, and where you're from, and then go ahead.
Okay, good afternoon everyone. My name is Faith Smith. I am a carer and a carer advocate from Lewisham, and I'm on the involvement register for South London and Maudsley. And it was my absolute privilege to have met Aji and Marcy and Kevin Clark's family, where I was introduced the 3 young men at the event, the Shanies event that we had on the 5th of February. Under Maudsley Learning, and from that we have kind of formed a close bond. And I just feel that, you know, when I speak, I am speaking as the mother of 3 young black men. And so you know, when I think of them going out on the road and doing things, you know, I think of Shaney and I think, well, how unfair is it that he was unwell and his life has been cut short? And he was unwell. He wasn't a criminal. He wasn't, you know, doing anything wrong. He was unwell. And if in the part that I can play of sharing the message and talking about Shaney, I think Aji, your ears must be burning, because I'm always, you know, in a good way, in a way that is saying that, you know, when people say, oh, I understand how you feel, but actually we can't understand. But all we can do is take our hats off to you and your family and others like you who are not sitting at home crying and saying, oh, isn't this awful? Yes, it is awful, but you're doing something to rectify and to raise awareness. And I liked what you said about, although this is happening internationally, it's also happening in Lewisham, it's also happening in Croydon, you know, it's happening in places that we know. So we need to kind of galvanise together and keep going, because it's not an easy task. But if you're grieving, why should you then have to be fighting over, why did my son die? How did my son die? How to prevent someone else's son from dying? So, you know, I just wanted to, I don't actually have a question, but I do have a comment. So, you know, and that was what I wanted to share. And I wanted to say that, you know, with the event of Zoom and Teams and everything like that, because you imagine all of us that's in this meeting trying to be in a room together would be rather difficult. But, you know, we are able to share. And, you know, although Aji and I have not actually met physically, we don't, you know, I feel as if I know you guys already, do you know what I mean? So I just wanted to say that, you know, I'm very proud and I'm pleased to do my part and to be a part of it, you know, not only as a black woman, as a mother of black sons, but, you know, as a member of society. As a member of society. So keep doing what you're doing, and those who are behind you, the lawmakers, etc., we are all watching you. So thank you. That's what I wanted to say. Thank you very much.
Thank you so much, Faith. A lovely friend. We've had many midnight calls. Thank you, Faith.
Thank you, Faith, and thank you for bringing that real challenge to us about the limits of our own ability to understand the other's experience. I think that's really a valuable. I love that. I love that you've raised that, and thank you for speaking back with such passion and encouragement to everyone in the room as well. Thank you so much, Faith. Okay, was it Colin you wanted to go to next, Aji? Colin, are you happy to speak? You're being spoken into the room. Are you okay to share your thoughts with us?
I don't know if it's worth anything, but I'll try my best. I think Aji has shown a unique ability to transfer pain into political activism, and
You okay, Colin?
Thank you, Colin. Just take your time. That's you're talking and sensing the way that Aji's using the pain and doing something very productive with it.
I suppose trying to get my humility back. Somebody's been sectioned, diagnosed, violated, restrained from the age of 17, been in prison, been in Maudsley, been in the pre-mental health practitioners, witnessed the police violated people on the streets, continued this modern form of slavery, which I form is the abuse of the black bodies. It's an intrinsic part of our psychology, our mental health practice. The indignity in which we treat people is abysmal. And how Aji can sit there with such humility to actually encourage us to integrate and work across colour lines and gender is unbelievable. And I have a campaign to make sure she gets her MBE, which is the Member of Black Excellence, OBE, a dameship. And also there should be money put aside for her to become a full-time ambassador with a professorship that leads the campaign. That lived experience is the central strategic reality about holding people account. She's the most significant political figure in modern Britain in terms of change in mental health legislation. I think we don't really recognise the power of that. We have got an event on October the 27th, but I've got to say something about Joy. Everybody has a responsibility in this political journey, and Joy has shown exemplary collaboration to work across the colour line, to engage in change. And I've seen her in meetings challenge people and take responsibility to work across the colour line, which is a really radical challenge. So my question to Aji is, Aji, can you canvass people to come to this meeting in October? There's loads of us here. We've got to get our asses together and get out there.
Yes.
Get back to the radical civil rights politics of the 60s. Do you know what I mean? Let us know. Do you know what I'm saying? I'm part of I'm co-chair of the restricted practice group. I love to work with Joy and what they're doing. So you know,
we'd love to have you, Colin.
I had to put my camera on because I know I was going to break down but I don't care about crying anymore.
So, doesn't matter.
No, I feel the same, Colin. It's a very, very emotional thing. It really is.
Yeah. Colin, thank you for the sharing of yourself. The reason I invited Aji to open the Living Lab was because when I first met Aji, which has only ever been on Zoom, I could see that there was the incredible work that she has done and her family have done to overcome what must be the normal response, which would be to be in defense and be very angry, and the work that she's done, which she attributes to God's forgiveness, asking her to forgive. I still think that is Aji and her family have taken the steps to work through that. And so for me, asking Aji today to open the lab was in response to who Aji is as a person. And I can't use words in the way that you have, Colin, to talk about the incredible position that Aji has in society. I can respond like you to say that she has an incredible power in our hearts, and you've also demonstrated that. So thank you for coming and sharing that today. Thank you also for sharing your observation about Joy challenging in meetings. I'll also share with you why I like working with Joy is that she allowed me to challenge her in a meeting. And that's how Joy and I started working together, because she showed me that she could really take a challenge and use it herself. So there's a lovely connection. Colin, thank you so much for being here today. If you've got any advertising for your group and your work, please feel free to put that in the chat and stay in touch with us as well. Thank you.
Yes. Can I just say that Colin's on the 27th of October, Colin has organised a conference that well, do you know, you see, when I talk to Colin, I say to him, Colin, can you say it in simple language so non-learned people can understand? He has a way with words, and he has really opened me up and has, you know, like I say, encouraged me all the way, and I really appreciate it. And do you know what? It's good, decent men who cry. I mean, it's not easy, but he has been through so much, and at times I'm sure he still goes through. And I take my hat off to somebody who is open, doesn't matter what other people say, but he's himself. He's a genuine, decent person. Thank you, Colin.
Thank you, Aji. I can see there's another hand up, but I don't know who it is. So if you're waiting to make a comment or ask a question of Aji and Joy, would you mind putting your camera on so that we can see you, or just speak out as Colin did? That's also fine.
Yeah, I think that was me. Sorry, I don't want to put my camera on just in case I become emotional. Yeah, I don't want.
That's
I don't.
Can you tell us who you are and where you're from?
My name is Lindani Dube. I work on the Mental Health Act operations team at the CQC. Thank you so much, Aji, for your talk. It's very inspiring. I think what I'll take away from it is that it's very thought-provoking. I think obviously you spoke to us, I think a few months ago, I think it was last year at our conference. So I've had bits of your story before. I think the only question that I have is that obviously earlier on you spoke about quotes regarding change and progress. I mean, in your own opinion, I know it's hard to answer this question because you don't work in this Mental Health Act settings, but do you feel there's been a significant change, particularly in restraining? I don't want to say restraining in young black men, but I just want to speak about restraining as a whole. Do you think there's been any change since? I mean, how long has it been? Since 2010, that's when Seni passed on. Do you think there's been enough? I mean, in your opinion, do you think there's been enough change? Or do you still
know, thank you so much. I'm sorry I didn't get your name.
Yeah, it's Lindani.
Lindani. Oh,
yeah, that's
thank
the one. Yeah,
that's a really, really good question. Possibly I can't answer it because you know what? If there had been real change, progress, would people like Kevin Clark have been in broad daylight? You know, I mean, this, you know, do you know how many people are being killed? If you go on the Inquest, the charity website, they update the numbers of people who die weekly. And I don't know if anybody has seen a documentary we did. Could I please ask everybody to watch it on the Guardian website or YouTube? It's called R.I.P. Sheney. And at the end, the girls say that as they were updating the numbers each week, more people were being killed. I mean, you know, I don't know. I'm sorry, I'm an outsider. Maybe Joy and Deborah, who work in the system or who have more contact with the system, would know more. But, you know, I'm sure Colin would agree with me. There has to be more. There has to be more. I'm sorry. It's not enough because people are still dying, still being killed, still been restrained in autistic schools. You know, I mean, they're not hopefully dying in autistic schools, but, you know, it's a beginning. It's, you know, I don't know. I don't want to lose, you know, I'm a glass half full person. You know, I try to be optimistic, but I don't know. The things are not getting better quickly enough for me, because people are still being killed. I mean, Kevin Clark was just, we saw it all. So, you know, Dalian Atkinson, what's that? All of that, you know, I mean, you know, they're tasering black people, black men, you know, they come with the same garbage, you know, we're supermen, you know, and they're bigger than us, you know, I mean, it's rubbish. I'm sorry to say. I feel a bit despondent sometimes, but then I can't be. There has to be hope, as Deborah and I were saying.
Aji, should we see if we can get some hope from Joy? Because I know that Joy's got this perspective. Joy, in a few words, what's your view on change?
I was just going to say, actually, Aji, I mean, as a mental health nurse at heart, you know, I haven't been in practice for some time now, but I still go into practice a lot and work with practitioners. And of course, we have our own student body of mental health nurses and beyond, Deborah, at the university. I'm a bit like you sometimes, Aji. I do get sometimes a head in the hands moment of despondency of, oh my God, you know, here we go again, and change isn't happening quick enough. But I seriously have seen, I think, you know, it's, for example, when we've got the Restraint Reduction Network conference in, haven't we, early December this year in Leeds for 2 days. That community of practice fills me with joy. It really does. When we go to those events, Aji, you get a real sense of a collective of people nationally who not only want to make change, who are making change and bring to the table, don't they, examples of good change. Look at Merseycare Mental Health Trust, you know, the work that they have done. That's groundbreaking. So part of me does think we have made some significant progress. There's no doubt about it. We still hear people using the language, and it makes my skin crawl. People still use the language of things like control and restraint. Drives me to distraction, and I check everybody that ever uses that. But that's much less so, I think, now than it's ever been. And there is a lot of work to do, Deborah, but I do feel that we are beginning to shape and turn hearts and minds. I've seen a big difference in the last 10 years.
Yeah.
Thanks, Joy. I'm just thinking about the work that other people like Beth Morrison and Deirdre Shakespeare are doing, other families, and Vanessa as well, where they're raising the issues in school around children who have learning disabilities and additional needs. So I think as the consciousness raises, Aji, there's maybe it's about the system, the whole system being more aware and starting in the early years and in schools and working with the whole system to prevent as well as to work with better ways of supporting people in the moment as well. So thank you for the question.
There's one final thing I think, Deborah, is that the national standards that have been launched that I mentioned, the national training standards on restraint and minimisation, they've been 20 years in the making. So the fact that they have come out now and people will be held accountable to those standards, you know, we've got there, Aji, and a lot of that has been on the back of your support and your work and you joining us at the RRN and other people like Beth, as you said. So yeah, we are getting there, but not nearly quickly enough. And as you say, one death, one more death, and you know, it's just
Thank you. Joy, can we go to Abiola, because Abiola, you've been waiting patiently, and I think you might be the last questioner. We may have one other question. We might be able to fit more to him, but Abiola, come and tell us who you are and ask your question or make your comment. We'd love to hear from you.
Hi, so I'm Abiola Rolala. I work with Joy on the Improve Act project, which is investigating Black men who've been detained under the Mental Health Act. So I'm like so incredibly excited to be here, and I've met you before, Aji, once, and it was so lovely meeting you, and I'm so glad that like you're here like telling us what happened and like the changes that you're making. And I'm so sorry that you're constantly having to unravel and dig deep into this trauma over and over again, and I'm so thankful that you're here doing it. I have two questions, but I'll save you because I think someone else has their hand up as well. I know that in the last year and like honestly for decades, people have been talking about prison abolition and police defunding and abolition, and the conversation around that is constantly changing and evolving. And as of late, people are moving into the realm of, if we're abolishing or defunding the police, surely we should investigate the relationship that police has with other institutions like mental health services, like schools, like social work. And I'd just love to know your stance on the conversation between like prison abolition or general abolition and like reforming like existing institutions, and like how your views on that have changed or evolved if they have. And the other question that I wanted is a bit lighter. I'd just love to know if there's any like quality or attribute of Sheni's that you wish you saw more in other people.
Yeah, I connived with that first bit first, because Seni was really, he was a campaigner. He respected people, and he respected the marginalized. You know, his friend in school who lived quite near us, he had slight disabilities, maybe with walking. I'm not sure exactly what, but anyway, at Sheni's funeral, he stood up and said that how Seni never let anybody bully him. He was younger than Seni, but because everybody knew that maybe I dropped them together or his mother dropped them together, Seni would not let anybody bully him. And he said that gave him confidence. You know, nobody said anything because Seni would be there. He hated bullies, just hated bullies, and always stood up for the marginalized. And that is something I encourage my grandsons to do, you know, to follow, and it's good. It's a good thing that if everybody could follow that. Listen, prison abolition and please, that is another big subject. I don't think, maybe Deborah will have another session on that. I'm not going to get into that at the moment, but I think for me, I don't see why police are called into national health institutions. I'm sorry. I know people say that sometimes, you know, patients are very, you know, carry knives or, you know, will harm themselves or other people. But I don't know why the police are called, and I would like to see that stop. I don't know how it's going to be done. And the other thing I would just like to big up is SLAM, South London and Maudsley Mental Health Trust, because I do a lot of work with them, because that's where Seni died. Yeah, that's where he died. He was killed in the Bethlehem Hospital, which is under SLAM. And I work with them weekly, daily. We work together to make things better. So big up SLAM, because they are, you know, they admit their faults. They're not perfect, but they're growing, they're getting better, and they admit their faults. I like that. You know, own up to what you do, and your you know, the gaps in your procedures and everything, and they have really supported us, and they've even started a wonderful guy called Lewis Beams, who's a nurse, restraint reduction nurse, who's involved with the RRN. He has started a training called Sheni's Story, and it's a whole training that they're developing. They've really taken it on board, and they're trying to improve. So I big up, so many national health trusts I speak to, and they're all trying. And I just would like to also say that there are lots of good people out there. Don't think I'm dishing everybody. No. There are millions of good people. You see them all the time. So, you know, don't take notice of me. Yeah.
Thank you, Aji. I think that's a really lovely place to draw things to a close. I know there's one or two other hands up, but I think if I've posted a survey into the chat, if colleagues would like to respond, if you would like to ask for further information, if you would like to get more involved with what we're doing in Manchester Met with education, early years or mental health, please just drop a line in the survey, and Joy and myself, we will get back to you. Aji hopefully is going to come into some of our work that we'll be doing with children children and young people around mental health. So we already feel that today's event has been a place of drawing us together and closing some of those gaps. I would like to also say again, thank you to Aji for sharing your story. I know it's come at a cost, and so we don't take it lightly what's happened here today. I am going to ask that we say thank you one more time to Aji and Joy, and then I'm going to ask for people to leave the room so that Joy and Aji and myself can work with each other to just slowly bring things down from the event today and think together and talk together by way of reflecting. So that's what's going to happen next. So please put your cameras on if you can, or put your microphones on and give and show your appreciation. And thank you so much for coming. Stay in touch.